Uterine fibroids. Uterine fibroids, also known as leiomyomas or myomas, are non-cancerous growths that develop in or around the uterus. These growths are relatively common, particularly among women of childbearing age. They can also impact quality of life. Disclaimer: please note that this information is for educational purposes only, and individuals should consult their healthcare provider for personalized advice. Uterine fibroids are the most common benign tumors in women of reproductive age. Studies indicate that up to 70 to 80% of women will develop fibroids by the age of 50. African American women are 2 to 3 times more likely to develop fibroids compared to other racial groups. The condition often emerges during the late reproductive years and may vary in size and number. The exact cause of uterine fibroids is not fully understood, but several factors may contribute. 1. Hormonal influence. Estrogen and progesterone, hormones that regulate the menstrual cycle, promote the growth of fibroids. 2. Genetic factors. Family history increases the likelihood of developing fibroids. 3. Other risk factors. Early onset of menstruation, obesity, and high blood pressure may also play a role. While some women with fibroids may not experience any symptoms, others may have heavy or prolonged menstrual bleeding, pelvic pain or pressure, frequent urination or difficulty emptying the bladder, constipation, lower back or leg pain, infertility or recurrent miscarriages in some cases. The severity of symptoms often depends on the size, number, and location of the fibroids. Diagnosing uterine fibroids typically involves a combination of clinical evaluation and imaging tests. 1. Pelvic exam. Detects irregularities in the shape of the uterus. 2. Ultrasound. Uses sound waves to create an image of the uterus and identify fibroids. 3. MRI magnetic resonance imaging. Provides detailed images of fibroids and surrounding structures. 4. Hysteroscopy. Involves inserting a small camera into the uterus to inspect the uterine cavity. 5. Blood tests help rule out other conditions such as anemia or thyroid issues. Management of uterine fibroids. Treatment depends on the severity of symptoms, the size and location of the fibroids, and the patient's desire for future pregnancies. Common options include: 1. Watchful waiting. If the fibroids are small and not causing symptoms, no immediate treatment may be necessary. 2. Medications, hormonal therapy, birth control pills or hormonal IUDs to manage heavy bleeding. GnRH agonists temporarily shrink fibroids by reducing estrogen levels. 3. Minimally invasive procedures, uterine artery embolization UAE, cuts off blood supply to fibroids, causing them to shrink. Myomectomy, surgical removal of fibroids while preserving the uterus. Hysteroscopic myomectomy removes fibroids from the inner-uterine wall via the vaginal route. 4. Surgery. Hysterectomy. Complete removal of the uterus, typically recommended for severe cases or women who no longer wish to conceive.